Running has become an important part of Julie's lifestyle.
I feel that I'm like rejuvenated after I run. I definitely find for me that it's a stress reliever, so it's become more of kind of a part of my overall wellness plan that I work running in just so that I kind of can keep my stress level down.
But hip pain was causing her problems and was taking the joy out of one of her favorite activities.
All right, you ready to run, Julie?
Yep.
She found help at the UW Sports Medicine Runners Clinic, a service provided for runners who are coming back from injury or just want to improve their performance.
When we bring someone into Runners Clinic, we're really looking at 3 different factors going into them. So we've got their training volume and their training history, which we take into account, and that also includes their footwear and what they're wearing. The next component is we do a musculoskeletal look at what are the muscle groups that are involved with running, what's their strength look like, what's their range of motion in the joint that's affected. And then the last piece, which is really the unique part of the Runners Clinic, which most people don't get in a more standard physical therapy practice, is that we look at their running mechanics themselves.
She was able to use the cameras and get different angles of my run and position
We're first going to look at your running. We're going to look at you from the side.
and sort of see what I was doing. And of course, when you can see yourself on a screen, it's much easier to understand what she's saying than when she's telling me to modify something that I can't see what it looks like.
And then we can walk through that video, and we're really looking at key events that happen during the running stride cycle. So we're looking how they're impacting the ground, we're looking how they absorb that impact, and then we address or we target our program and retraining towards those faults that we see.
Liz worked with Julie to change her stride. She's leaning forward a little more.
Come on back the other way, letting your hips twist.
And she's also incorporated core muscle work and a dynamic warm-up to use before Julie starts her run.
Before I started working with Liz, I would experience a lot of pain at the end of the run, specifically when I would start walking. And so by doing the dynamic warm-up, I'm sort of engaging my hip specifically, which was what was bothering me the most. And then I find that I can run longer.
Keep going.
I find the plan workable because she also helps me to understand like what I can put in and what I can take out to make it realistic for like my day-to-day life.
I'm a runner myself. I've been for a long time. I've done a marathon, and I really do understand what runners are going through from all levels, even the high school athletes, because I was a high school runner as well. The same way with our other Runners Clinic providers, they all have running as part of their own exercise programs, really do understand what their goals are and what struggles they may be facing. So we really take a more holistic approach to the runner themselves, kind of try to understand all the factors that go into the injury that they're currently experiencing.
I mean, I'm blown away by the facility and the equipment and the ability to work in an atmosphere that's really for athletes, I feel. So it doesn't feel medical, it feels more of like a performance area. I really enjoy that.